This one's for all you wonderful nurses out there. For those who don't know me, I am a nurse. I haven't been working though, I'm on mat leave. So if you know a nurse or you are a nurse, then watch this video. Or you know what, if you don't even know a nurse, watch this video anyways. Things you need to know about a nurse. A lot of people don't know the stress that comes with being a nurse. People that are not as respectful towards nurses. It's not just nurses, it's all the healthcare professionals, all the workers everywhere, anywhere. Somebody that works at a store, somebody that works at a restaurant, somebody that works at a gas bar, anywhere. Respect is key. So me being a nurse, I kind of know what's behind the scenes, okay? I worked in the emergency for a bit and things can get pretty busy. I mean, I've worked in other departments as well, and the other departments can be very busy as well. So general care unit where you have mixture of different cases, OBS, so labor and delivery, where it could be very hectic as well. The thing with nursing is I became a nurse because I wanted to give care to people, because I love caring for people. I love helping them. One person asked me once, why did you become a nurse? And that was a simple question to answer. I used to always say, because I love helping others. The funny response this person told me, which is true, is, you know, there's other professions out there that you can do to help people. And I laughed and I said, you know what? You are right. My first instinct was nurse. I want to be at a patient's bedside and I want to care for them. As a nurse, you're not always appreciated. You've got sometimes things that happen to you. Sometimes things happen during a shift and it's out of your control and you just have to deal with it. And sometimes you end up going home crying about it, but that's part of the profession. Sometimes you get patients that scream at you. Sometimes you get physically abused. And that's not just with nurses, even ward aides. I worked as a ward aide as a student when I was doing my nursing course, and it's not an easy job. So all you ward aides out there, you guys are doing such a great job. Also, all of those who work in the hospital, every department, all of you guys we see you. We see you. Before you decide to scream at a healthcare professional or disrespect them because they are simply trying to do their job, just try to think twice before, please. Whenever you're in the emergency room and you are waiting to be seen, this is taking forever. We don't know what's happening behind the scenes. Somebody is crashing and they need CPR. All the nurses and doctors are in there trying to save that person. And before you get up to go shout or tell that secretary off and ask, or that nurse, you are tired of waiting, which happens and it's normal. Everybody has feelings and everybody is trying to do their best. It could happen that you see something that you don't like and you're like, you know, they're not doing their job. Most of the time, it's because they're doing their job and they're simply trying to do their best. Just know, most of them that are having those days, they go home, they're not happy, they're sad, they're emotional, they're thinking about their day, they're thinking about that patient they lost that they worked on for hours and didn't make it. Being a nurse is not easy. It's worth it, but it's not easy. You build relationship with patients. Whenever you lose that patient in palliative care, that person sticks with you. I still remember people that touched my life. As much as a patient states that we touched their lives, they also touch ours. I used to always think of my profession as a blessing, that I'm lucky to be a nurse. Not only do I experience the most stressful things, I also experience the most wonderful things. Working in labor and delivery, not everyone witnesses a baby being born. Such a wonderful experience to be a part of. Seeing life coming into this world is just such a wonderful feeling. And then there's palliative care, where it's your heart is with that person and you're trying to give them the best comfort care that you can give. And then you lose that patient. You're broken for that family because your heart and mind are with them. I used to think of my job like I'm experiencing both life and death. That is just a feeling that you almost can't even explain it. You can't even explain the feeling. It tries to remind me why I became a nurse. All you nurses out there can probably relate and agree. You often ask yourself, why did I become a nurse? Why did I become a nurse? Because a lot of your shifts consist of that question. Why did I decide to be in the healthcare profession? I know. All of you guys out there, especially right now, working through the pandemic, my heart is with all of you. You guys are all doing such a wonderful job, just a great job. You guys all deserve to be appreciated. So thank you all so much for your care. Thank you so much for your compassion. Thank you so much for all that you do. You guys are amazing. Keep it up, and please don't give up.